So thanks for that question. Absolutely. We work with U.S. colleagues at US CDC, at NIH, and a number of academic institutions across the whole country in a variety of networks and different types of platforms since the beginning of this pandemic, and that will continue. We have active engagement through all of our global expert networks, which are clinicians and laboratorians and IPC specialists, risk communicators, et cetera. And so we will continue to do that as the pandemic continues. So if I might add, just to say that the situation in Guatemala, in the Americas, is very much the current state that they're in right now is the state that many countries were in several weeks ago, several months ago. And what the DG spoke about today, very much of sort of the back to basics and back to the fundamental approach, this comprehensive approach that needs to be used to tackle this virus, is very much the same as we've been saying from the beginning. The idea that we have an entire population engaged, knowing what each individual what role each individual plays within this pandemic is fundamental. How can I protect myself from infection? How can I protect my family from infection? How can I prevent the possibility of me transmitting to someone else who may be more vulnerable? How do we have a public health infrastructure in place to be able to find cases, to isolate cases, to test cases, to care for cases in medical facilities, ensuring that they receive adequate clinical care depending on how the disease that they develop? Do we have the right workforce in place to be able to do contact tracing, to find the contacts of the known cases and quarantine those contacts? Do we have the right testing strategy? Do we have enough tests in place and enough labs to carry out those tests? Do we have this all-of-government approach, bringing in all different sectors, not just the health sector, so that we can maintain essential health services, but also try to keep other systems going? And so that comprehensive approach of what Latin America, Central America, the Americas need to focus on is very much what all countries need to focus on. And we need to remind ourselves that these interventions work. Not one intervention alone, but the combination of these interventions work. And so staying focused on that, providing the support that we can through our regional office, having the solidarity and support in getting supplies to where those are needed is really what we need to be focused on. And I'd just like to add on the focus on the now. So as Mike was saying, we need to focus on the now. This is far from over. I know many of us would like this to be over, and I know many situations are seeing positive signs, but it is far from over. And we need to shore up our activities. We need to build up the activities in the infrastructure that is not in place in many countries and continues to not be in place in many countries. And while I don't want to focus on the negative, I want to focus on the opportunity to build this workforce, build this infrastructure that isn't in place in most countries. And unfortunately, we've seen that in many countries. We're talking about the workforce of public health professionals who can carry out contact tracing. We're talking about trained medical professionals who have adequate training in respiratory diseases, specifically for COVID-19, but for infectious diseases. Looking at supplies, making sure that we have adequate personal protective equipment for every health worker on the planet that needs it. We're talking about treatments and effective, safe and effective treatments for COVID-19 and for emerging respiratory pathogens. We're talking about vaccines. So there's a lot of work that needs to be done, and we need everyone to remain focused on achieving the goal at hand, which is stopping this pandemic, which is suppressing transmission and saving lives, and there's a lot more work to do. So let's celebrate the successes that we do have, but let's remain focused on the remaining work that needs to be done, because unfortunately this is far from over. So thank you for the question. So this is a question about the viruses that are circulating globally, the SARS-CoV-2 virus, which is the virus that causes COVID-19 disease. So there are more than 40,000 full genome sequences that are uploaded to publicly available websites, and there are a large number of scientists and virologists and professionals who are looking at the sequences themselves. There are different groupings of those viruses. You mentioned 2 strains, but there are several different groupings. There are some subtle changes, some that are expected in an RNA virus, but none of these changes result in differences in the way that the virus transmits or in the way that in the type of disease that the virus causes or the severity that the virus causes. We have a global lab network where we're discussing this with them. This is an area of active research and active discussion. And we're constantly looking at the viruses that are publicly available and the different segments of that. There are a number of different types of studies that need to be done in labs to look at how each of these viruses will behave. But so far, among all of the viruses that are available, there are no differences in the way that this virus transmits or in the disease that this virus causes. So thanks for that question. That is something that our infection prevention and control network is discussing. So with the recent guidance that we put out, as you know, we put out guidance on a fabric mask and the layers and the materials that can be used to build and to make an effective mask. What's important about the mask is not only the materials that are used, but also the way that it actually covers your face in terms of providing that barrier over your nose and your mouth. There is a role for face shields if masks are not available, but that is something that needs to be discussed on where and when that can best be used. But I should remind you that masks alone will not protect you. Face shields alone will not protect you from infection. It's really important that all of the measures, including physical distancing, we know that physical distancing works of at least 1 meter. That is really paramount. It is really important that that is maintained. That hand hygiene, washing your hands with soap and water or an alcohol-based rub, practicing respiratory etiquette, sneezing into your elbow, all of these must remain in place. So I can start, and perhaps Mike would like to supplement. So there's a couple of things in the question that you just asked. One is the number of cases that are being reported as asymptomatic. And so we hear from a number of countries that X percentage of them are reported as not having symptoms, or that they are in their pre-symptomatic phase, which means it's a few days before they actually develop severe symptoms. In a number of countries, when we go back and we discuss with them, one, how are these asymptomatic cases being identified? Many of them are being identified through contact tracing, and so which is what we would want to see, in that you have a known case, you find your contacts, they're already in quarantine, hopefully, and some of them are tested, and then you pick up people who may have asymptomatic or no symptoms or even mild symptoms. The other thing we're finding is that when we actually go back and say how many of them were truly asymptomatic, we find out that many have really mild disease, very mild disease. They're not quote-unquote COVID symptoms, meaning they may not have developed fever yet, they may not have had a significant cough, or they may not have shortness of breath, but some may have mild disease. Having said that, we do know that there can be people that are truly asymptomatic and PCR positive. The second part of your question is what proportion of asymptomatic individuals actually transmit? So the way that we look at that is we look at, these individuals need to be followed carefully over the course of when they're detected and looking at secondary transmission. We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare. And that much of that is not published in the literature. From the papers that are published, there's one that came out from Singapore, looking at a long-term care facility. There are some household transmission studies where you follow individuals over time and you look at the proportion of those that transmit onwards. We are constantly looking at this data, and we're trying to get more information from countries to truly answer this question. It still appears to be rare that an asymptomatic individual actually transmits onward. What we really want to be focused on is following the symptomatic cases. If we followed all of the symptomatic cases, because we know that this is a respiratory pathogen, it passes from an individual through infectious droplets. If we actually followed all of the symptomatic cases, isolated those cases, followed the contacts and quarantined those contacts, we would drastically reduce. I would love to be able to give a proportion of how much transmission we would actually stop. but it would be a drastic reduction in transmission. If we could focus on that, I think we would do very, very well in terms of suppressing transmission. But from the data we have, it still seems to be rare that an asymptomatic person actually transmits onward to a secondary